When it comes to healthcare and health insurance in this country, we have a billing problem. We have by far the highest charges for the same services than any other country in the world.
The industry has forgotten who the customer is. You have employers and employees, hardworking Americans who are paying this freight, but the system is designed to the benefit of the large providers and the large insurance companies. You contribute payroll to the equation, and you have to pay out of pockets when you go see the doctor or you go to the hospital, but you don't have any control or vision or transparency into that process. So you're a party to it, but you have absolutely no visibility to it.
When you hear all these stories about brokers and how they're making money in this way and that way, and there's a hidden agenda, you always think, well, that's not my broker. Their profits far exceed what you think you're paying them. And you lose trust. You lose trust in the broker.
The conflict of interest pervades every piece of the healthcare system. The PBMs are a Machiavellian nightmare of hidden costs. I had no idea that was the case.
When you look at the profits these hospitals make, low end 7+% profit, high end almost 20% profit. Now, most people today would think 20% profit's outrageous. My company doesn't make 20% profit. Wish we did, we don't. Where does that profit come from? That to me just seems outrageous.
I think the tipping point came in my presentation to the owners of our company and going through examples that were provided me by Cost Plus advisors and ELAP on what hospital bills, what hospitals charged, and what the actual cost of those services were, right? And it was getting to that anger point where the owners of the company are saying, you know, that just isn't fair. They bought in, they were all in.
The Cost Plus model is several different components that each address specific areas of healthcare spend. We have a different mechanism for reimbursements that makes a whole lot more common sense. And we have components that go after that billing problem in the various sectors, such as prescription, hospital charges, outpatient charges, etc.
An employer actually has the opportunity to see exactly what his costs are. It really allows them to really better treat their employees to better health care.
When we transitioned to Cost Plus, what we began to see was immediate transparency. I was seeing how much the hospital bill was. I was seeing what the discount was. I was seeing how much our fees were to get that discount. Everything was very open and above board. There was nothing hidden in it. It was an obvious and apparent transaction that made sense to me.
We have saved a substantial amount in the last 2+ years on our plan by going to the Cost Plus model. With those funds, we have been able to not just once but twice reduce the deductible to our team. We've also been able to add benefits to the plan, and through all that, we've not had to raise premiums.
We're also saving huge dollars on scripts. Our prescription savings right now, we believe by year end will be about 40%. That's astounding for me.
The employers win in this Cost Plus model, and we're winning as a stop-loss carrier. And in our captive, employers are benefiting even more because we are giving a piece of the risk back to the employers for their favorable experience.
We just had a Milliman study done which projects that we're going to save about $9 million over the next 5 years using this model. That's a substantial savings, and that's not all of the savings that we will enjoy because of the other parts of our program.
I believe that the Cost Plus and the Cost Plus advisors in particular really are one of the few organizations out there or individuals out there that are giving employers an opportunity to regain control of their own healthcare costs.
Would I recommend Cost Plus to other employers and other companies? Absolutely. it's been wildly successful. I mean, really, really successful. It's an easy process to manage. It's not as daunting as it may seem to make a big switch like this. You've got really solid partners to help you along the way. I would certainly recommend it.